It's a decision that most parents make at some point, deciding they're done having children. Yet a new survey found that this triggers little discussion between women and their health care providers. As a result, many women aren't learning about all their options when it comes to permanent birth control. And joining us today to discuss what women need to know, including a surgery-free option, is Dr. Barbara Levy. Dr. Barbara, how are you?
I am great, Laura. How are you today?
I'm doing well. Thank you so much for being with us this morning. And I guess we'll start. Why is it that women are not having this conversation with their doctors, according to the survey?
Well, you know, that was really disturbing to me. What we found in the survey was that 76% of women were done having their families, and yet only 24% of women actually talked to their doctors about it. You know, as a healthcare provider myself, that was really disturbing. What we found was that I think doctors expect women to bring it up, and women expect that doctors will tell them if there's an option available to them that they're not doing now. So there's a huge disconnect between the doctor and the patient.
Well, Dr. Levy, I can imagine that results in a lot of maybe mistaken pregnancies, or women that they go through life and they say, I really wish that I would have gotten permanent birth control or something taken care of, and they just never were aware of what to do.
Well, that's true. What we found in the survey was that 90% of women knew about the surgical options available to them, and honestly, that turns off a lot of people. I'm not surprised about that. But only 12% knew about newer, non-surgical, permanent options available. And I'm here on behalf of Assure to tell women about this option. It's been available for 10 years, and so few people really know about it.
Expound a little bit upon that, if you wouldn't mind, Dr. Levy. Tell me exactly what this non-surgical option is and how our viewers could get that, if at all possible.
Absolutely. It is an office procedure, can be done in about 10 minutes without requiring an anesthetic. And they're tiny little, very flexible inserts that are put through natural body cavity, through the cervix, into the fallopian tubes. And the body grows in naturally over a couple of months, blocks off the tubes. Then there's a confirmation test so that the woman is absolutely totally convinced that this has blocked off her tubes, and she's good to go. No more hormones, no having to remember pills or devices or other things, and she's free.
Well, with women having children later and later in life these days, Dr. Levy, how would someone know they are truly ready to stop having children? Because I imagine that if this is a permanent way of stopping births, then you would really need to make sure that you know this for sure. That's what you want to do.
Absolutely. And what we found was that there are several issues. Age, as you would expect, is one of those things. I have women come into my office and say, you know, I really don't want to be the 60-year-old in the kindergarten room. So age is a factor. If they've had the number and gender of children that they plan to have as a couple, that is a factor. And unfortunately, in this day and age, finances is a big factor for couples in determining when they're really done with the size of their family.
Well, you're at a very big OB/GYN conference right now. Tell me a little bit about the new research that has come out and what women of all ages might be able to benefit from.
So the research being presented at this conference is about the worldwide experience with Assure procedure. There have been 500,000 women or more worldwide who've had this procedure done over the last 10 years. And what we found is that the data is really terrific. The effectiveness is 99.8% worldwide. That is just dramatically better than any other option available to women. So very exciting news for women to have this non-surgical option that is so terrifically effective.
Well, Dr. Barbara Levy, thank you so very much for being with us this morning. And I guess the last question to ask you would be, where can our viewers get more information about all the things that you talked about this morning?
Well, I would always encourage the viewers to talk to their doctors. Obviously, that's number one. There's a great website. It's www.assure.com. Wonderful information for your viewers.
Well, thank you so much, Dr. Levy. We really do appreciate it. Have a wonderful day.
You too, Laura. My pleasure.
Thank you. All right, we've got much more Low Country Live coming up after this break. Stay with us.